Good morning, everyone. I'm Dr. K. Indulatha, second year postgraduate from Karnool Medical College. My presentation today is case series of fundoscopic findings in patients with anemia. Anemia is a hematological disorder presenting with various ocular manifestations. Conjunctival pallor, retinal hemorrhages are the predominant features. Anemia occurs when the RBC or hemoglobin levels are below the normal. The cause of anemia may be due to defective production or excessive destruction of the RBCs. Retinal hemorrhages were first described at Ulrich in 1983. The risk of retinopathy increases with the severity of anemia, particularly when the hemoglobin levels fall below 6 gram per son. The ocular manifestations of anemia are dry eye, conjunctival hemorrhage, lid hematoma, orbital hemorrhage. Fundus changes include retinal hemorrhage, subhyaloid hemorrhage, central retinal vein occlusion, vitreous hemorrhage, optic disc edema, and optic neuropathy, macular edema, and rod spots. Thrombocytopenia will be associated with anemia in many situations, causing coagulation defects and hemorrhages. Coming to retinal changes in anemia, hemorrhages, dot blot hemorrhages occur in the deep retinal layer. Superficial hemorrhages occur in the nerve fiber layer, which is the most common finding in anemic retinopathy. Sometimes subhyaloid hemorrhages may also be present. Rarely vitreous hemorrhage can occur. Cotton wool spots occur due to retinal nerve fiber layer infarction. Vessel changes include arterial attenuation and dilated tortuous veins, which is seen in severe anemia cases. Rod spots are white-centered hemorrhages that result from retinal capillary rupture and extrusion of whole blood, followed by platelet adhesion to the damaged endothelium, initiating a coagulation cascade and forming of white lesion in the center of hemorrhage, which is a platelet fibrin thrombus. Hard exudates occurs due to leakage of lipoproteins from retinal capillaries in the outer plexiform layer. Optic nerve changes include edema, optic neuropathy, optic disc pallor in the later stages. This is a hospital-based cross-sectional study including 60 patients with anemia of various etiologies attending medicine, gynecology and surgery departments. This study was done in Department of Ophthalmology in Karnool Medical College. Informed consent was taken from the patients. Complete hematological workup was done. Patients with diabetes and hypertension were excluded from this study. All the patients were examined for retinal manifestations in detail. Visual acuity of both eyes was documented using Snellen's chart, and anterior segment examination was done with torchlight followed by slit lamp biomicroscope. Posterior segment of eye was thoroughly examined for retinal hemorrhages, cotton wool spots, macular star or optic disc with the help of direct ophthalmoscope, and pictures were taken with the fundus camera. This study was conducted in 46 females and 14 males, and most common females were affected, accounting to 76.6% and males 23.3%. The most common finding was rod spots, which accounts to 66.6%, followed by fundal pallor, cotton wool spots, flame-shaped hemorrhages, dot blot hemorrhages, venous dilatation, tortuosity, macular edema, and preretinal hemorrhages. Most most of the patients presented with moderate anemia, accounting to 41.6%. These are the pictures showing macular edema, boat-shaped hemorrhages, dot blot hemorrhages, superficial hemorrhages, and hard exudates. Ocular manifestations of anemias of various etiologies can result in different ocular manifestations. Nutritional anemia is the most common abnormality in India. It may be due to iron, folic acid, or vitamin B12. Iron deficiency is the most common type of nutritional anemia. Dr. Shitol Satish, Dr. Jakal Tapan P in their study reported maximum number of iron deficiency anemia among nutritional anemias. In our study, retinal hemorrhages were present in 78.3% of patients with severe anemia and 20.5% of patients with moderate anemia. The most common presentation were retinal hemorrhages, rod spots, and cotton wool spots. Retinopathy is a frequent finding in patients with severe anemia. Retinopathy was found in all patients with concomitant anemia and thrombocytopenia. Ophthalmic manifestations do not require any specific treatment other than controlling thrombocytopenia and anemia. Ocular symptoms can represent first sign of life-threatening systemic diseases like severe anemia, and thus facilitate timely diagnosis and treatment. Thorough examination of the eye with a suspicion of systemic diseases and control of disease will help improve retinopathy associated with severe anemia. Thank you.
Okay, good presentation, Amma. What do you think is the pathognomonic sign that we can say that it is due to anemia among all your findings?
Broad spots.
Yeah.
Yes.
Yes. Do we need to intervene? I mean, any ocular intervention is needed in these conditions?
Control of anemia is the main.
Is the main thing. At any point of time, can we intervene?
Macular edema.
If there is a very severe vitreous hemorrhage,
hemorrhage.
do you want to intervene?